Good evening, class. My name is Professor Ben Constant. You guys can call me Professor B. Today we'll be going over the principles of a manual differential. Our learning goals for today will be to learn how to go ahead and prepare and interpret a manual differential. Our objectives today, after completing the class, you guys as a student will be able to identify individual equipment required to perform a manual differential, determine how to make a slide for manual differential, explain common errors in evaluating a manual differential, demonstrate entry-level knowledge in reporting the basic components of a manual differential, differentiate between a monocyte, neutrophil, eosinophil, lymphocyte, and basophil in a manual differential with 90% accuracy. Now, you might be asking yourself, what is a manual differential? Basically, this is a procedure that would normally follow a CBC. Typically, it is flagged from the analyzer, depending on what kind of parameters that is set by the hospital laboratory SOP. What will happen is a tech will go ahead and take a EDTA tube and will make a slide from that tube, and they will use that to go ahead and evaluate the cells that are seen from that peripheral blood smear. In doing so, will assist the doctor in helping them try to identify certain disease processes that the patient could be experiencing. So when we're doing a manual differential, we're in this case we're going to be focusing on just the basic parts of it, and mainly just the main parts. And essentially, we'll be considering this a normal patient. All manual differentials are put into three main categories, which is differentiating between leukocytes, erythrocytes, and thrombocytes. Leukocytes, also known as WBCs, are differentiated into different categories. For example, we have the lymphocyte. As you can look at the picture, we notice that it does have a large nucleus, has a very small amount of cytoplasm, very uniform shape. This is also the second most abundant leukocyte in the blood, depending on where it originates from and the location of maturation. Depending if it's from bone marrow, it could be a B lymph. If it's from the thymus, it could be a T lymph. We often see an increase in lymphocytes in viral infections. Here we have a monocyte. Monocytes, as you can notice from the picture, are extremely large. One major characteristic of a monocyte is the crushed glass cytoplasm that you will see in majority of all monocytes. They will have vacuoles, which is another key characteristic. Not all monocytes will have vacuoles, but a large majority of them will. They are seen in a lot of different disease processes, but majority of them are seen in viral disease processes inside of a human being. A lot of monocytes will become macrophages when they are entered into tissue. This is a neutrophil. Now, neutrophil is very unique. One thing that we can go ahead and notice is that the nucleus of the neutrophil is split into lobes. You see here, a typical neutrophil will have anywhere from 2 to 5 lobes. We typically see a high number of neutrophils in bacterial infections, and another key characteristic of neutrophils is the visible granules that they use in relation to attacking the bacteria and other pathogens that they come in contact with. They do have a large amount of cytoplasm, and these are the most abundant leukocytes or WBCs inside of blood. These are eosinophils. And unlike the neutrophils, which has anywhere from 2 to 5 lobes, eosinophils will typically only have 2 lobes in the nucleus. Another key characteristic of the eosinophils will be their pinkish granules, and they are typically seen often in parasitic infections. Now, these cells are not seen in high numbers when it comes to seeing them in peripheral blood. These cells are called basophils. They are typically seen in allergic reactions Their key characteristic is their large purple granules, which actually makes it very difficult for you to see their nucleus because their purple granules surround the cells completely. A big characteristic of these is their release of histamine and their relation to mast cells as well, which are typically not seen in peripheral blood smears when we're doing a manual diff, but we will see basophils when we're doing our peripheral blood smears. Now we went over the WBCs or the lymphocytes. Now we're going to talk about erythrocytes or RBCs. RBCs are erythrocytes or RBCs are pretty much the blood component of your body. These are what's going to be carrying the oxygen throughout your whole entire body. One thing that you'll notice about them is that they do not have a nucleus. Now, majority of RBCs in a normal patient will have a uniform shape, and you will also notice a lot of them will also have a very consistent central pallor. And this is from that biconcave shape that a lot of RBCs have. Thrombocytes, also known as platelets, which are part of your clotting cascade to help you with if you get a cut or any type of damage to yourself, are also seen in peripheral blood smears, and it's something that we also look forward to do when we're doing a manual differential. We would actually do a count of those as well. They are much smaller than RBCs, and they're purple and white in color, as we can see here in the picture. Now, thrombocytes are very large in numbers, and a typical human being can have anywhere from 150,000 to 450,000 platelets or thrombocytes in their peripheral blood. So when we're doing a manual differential, there are certain things that we are trying to categorize. When we're looking at leukocytes, we are counting 100 WBCs. When we count 100 WBCs, we're going to differentiate those 100 WBCs or those 100 leukocytes into the different categories that we went over, whether they be neutrophils, whether they be eosinophils, monocytes, etc. And we're going to go ahead and use that to get a percentage of an idea of how much of each individual cell is predominating inside the peripheral blood when it comes to leukocytes. When we review the erythrocytes inside peripheral blood, we are looking at predominantly the shape and size of these RBCs, and this is what we're taking into account. We're going to be looking at any type of abnormalities that they have, any type of inclusions that they may have, and we're going to go ahead and use this information to document it so that way the physician will be aware. When we do platelets, we're going to be doing platelet counts. We'll be reviewing 10 fields at 100, at times 100 microscope, and we'll go ahead and get an average platelet estimate, and then we'll go ahead to estimate whether it's going to be an increase, adequate, or decreased platelet count for the patient. So to go ahead and make a slide, we want to go ahead and make sure we're at a 45-degree angle, and it's going to be a smooth motion. We're going to make sure that we drop a drop of blood onto the slide. And from a 45-degree angle as shown, we're going to slide back and slide forward in a very quick manner, ensuring that we don't have any stoppage or any gaps. We're going to show that video one more time. Real quick drop. And then we slide, make sure the slide is saturated, and one quick motion. And then afterwards, we will go ahead and place the slide onto an automatic stainer, so that way it can be stained with white stains. That way the peripheral blood can be reviewed. So we're going to do a group activity now that we've seen a peripheral blood smear to go ahead and see if you guys can go ahead and differentiate the different things that we can see from a manual diff. So I want everybody to split into 4 different groups, and on a sheet of paper we're going to review the next video, and I want you to quantify the any things that you see with erythrocytes, I want you to differentiate between the leukocytes, and I want you also to differentiate to quantify how many thrombocytes that you have. And I want you to compare and average the results with your group members. You guys ready? Everybody in their groups? All right, let's go. All right, I'm going to play it one more time, just in case that you guys can go over your numbers and your figures. So, did you guys get 13 neutrophils as well? So check around with your group members to see if you guys got the same amount as well. And that's it. Thank you guys for your time.